Well, good afternoon. My name is Paul Hoover. I serve as the president here at Kettering Health Hamilton, and I am joined with Tina Winkler. Tina, you are a nurse on 4 Main. You typically work nights.
I do.
And Tina has continued to draw the short straw with having to sit next to me. And you've probably seen a few posts that I've put up before. Tina was the recipient or nominee for Cameos of Caring, which is a pool of
Very surprising.
Yeah, very surprising, but not surprising after I've gotten to know you and those who work with you. And we've had dinner a couple of times, and the last time that I had the opportunity to talk with Tina, we sat with her mom and got to know your mom, and just had
It was a very nice evening.
Had a wonderful time. But one of the things that we just maybe talk a little bit more about is just get to know Tina a little bit more. So Tina, how long have you served here at Kettering Health Hamilton?
14 years. I started my nursing career here on 4 Main, and I'm still on 4 Main. Just moved from being an orthopedic nurse exclusively to being one of the clinical coordinators on the floor.
Yeah. So why did you go into nursing? Why did that call? How did that speak to you?
Throughout my youth, growing years, my family always took care of our family members. They were never in a home, they were always in our home. And when they had medical issues, we took care of them. From the time they, were diagnosed to the time they passed away. And the one that touched me the most was my father. It was difficult, not only because he was passing away, but some of the things that were said when he was diagnosed, because it was the second time he was diagnosed. And the bedside manner and how people did not have any toward him or the family, which kind of made my mother leery of bringing people in, so we did everything. Hospice came in at the very end, but I was basically nursing him. Myself and my sister-in-law were nursing him at home. And it didn't happen, I didn't go into it right away. It was a few years after that. But I have a sister that's also a nurse. She's been a nurse for 30 plus years. And I knew I always wanted to do it, but I didn't actually know how, I guess. I was married at that time, married for many years at that time. And one day something just hit me, and I stopped at the college, Miami University, and just went in and put myself out there. And here I am now.
So did you go to Miami Hamilton?
I did.
Okay, so Miami Hamilton is a wonderful campus just about
Yes.
2 miles down the road. I always say that I love when I see the Miami red scrubs on the floor. It's going to be a good day.
Yeah.
They graduate some excellent nurses. So 14 years later, you've worked on the same unit.
Yes.
And I know the team, you end up precepting a lot of the newer nurses that come in.
I do.
What is that like, training newer nurses?
It's interesting to see how they view nursing, because a lot of them are just about the medicine, and that's not what it should be. It should be about the people. Not to take anything away from the medicine, but I think to heal a person, it has to be the whole person. It can't just be medical. So trying to instill that into them and having them spend a little bit more time getting to know the person, and just sit down and talk to them.
Yeah. Now nights, if you've ever been around a hospital, the night crew is always a special group.
We are.
And at first you show up and they're like, what are you doing here? What do you want? But after you get to know them, they're just normal folks. They just sleep at different hours.
Well, we never see you.
Yeah, that's right.
We never see anybody.
So what's it like working nights for those folks who haven't done that? What's it like in a hospital?
A lot of people think that nights is you stick a person in bed, you give them the nighttime medicine, and that's it.
Yeah.
Nights aren't like that.
No.
We do have some nights that are kind of like that, you know, when people are just having an extremely busy day and they're just wore out. But typically we're running for the 12 hours around the floor.
Yeah.
Call lights are crazy. A lot of things go on, you know, medically and emotionally with patients. And it's a little bit different from days, because even though days is busy, they have more outside help that can come in.
Yeah.
On nights, we're like an island. You know, we have to pretty much count on each other. And I personally think we have an excellent team on nights, especially for main staff. It's a good group.
Yeah.
Yeah, we can count on each other.
Now, you worked throughout the entire pandemic. Maybe let's walk through a couple different aspects of that. What was it like those early days of the pandemic, Tina? What were some of the emotions that you and the team felt?
Like I've said before, with the pandemic, it started before the pandemic, because we on the floor, we knew something was going on prior to it ever having a name. We were getting patients that were extremely sick. It made no sense. They tested negative for everything, but they were still having these issues. We were losing patients and they were still having these issues, and no one could put a face to it.
Yeah.
And then when it came about that, yes, it was COVID, it was it made us switch gears in a way, because you had to mask up, you had to wear these, you know, everything. And I understand, you know, that's what we needed to do. But we kind of felt, I guess, that it should have been caught prior to being COVID, because we were all exposed.
Yeah.
And we all had it, you know. There were staff that were taking like leave of absence, and those of us that stayed. And even though we didn't all work on the COVID unit itself, it was a terrible time. It was a terrible time. And then when people come back and it's like, oh, it was awful, it made us, I don't know if we were hurt, I guess, in a way. That, you know, I understand people's reasonings for doing, but we felt alone. You know, a lot of the times we felt alone. In the hospital and that, they were there for us, but being there for us on the sideline, you know, because everything's closed down and we're here. So it was rough. It was very rough. And everybody is still trying to get over that.
Yeah. I mean, in the midst of the pandemic, it was almost as if we had these mini pockets of isolation. So we would bring food up to the floor, not just for the patients, but for the staff.
Right.
And I know that, you know, I'm typically out on the floor, and I was very concerned for myself and the safety of my family.
Right. And that's understandable.
Yeah, and yet we all ended up, and I think you experienced this especially, in these small pockets where you're just, I think you told me that just you were very alone.
Yeah.
And yet you're with people, but yet it felt very lonely.
Yeah.
Talk about what clinically you saw and what impact that had on you as a caregiver, Tina.
I think one of the hardest parts in caring for the patients was their isolation. You know, we were there, but we could go. We could leave. We could go home after 12 hours or 13 hours. We could go home. But these patients had no one.
Yeah.
You know, they only had us. And that was so difficult. So difficult, because the family members would be angry. The patients would be angry. And you could only hold their hand, you know, and talk to them. And assure their family members over the phone, you know, we've got them. You know, trust in us that we've got them. You know, and if things turn to the worst or whatever, we still have them. We will get them what they need.
Yeah.
You can trust us with them. And that was hard. That was hard because they were like family members at that point.
Yeah.
Because they were there for a long time.
Yeah.
They weren't there for 2-3 days and go home. They were the family. So we had to treat them like family. And a lot of them became very close to us. A lot of nurses had issues, especially if we lost someone, because you hold on to that. They just don't, that memory just doesn't go away. And you think, what could I have done better? Did I do everything for them? Did I take care of them and give them what they needed?
Yeah.
And you hope you did. Sometimes you just never know, but you hope you did.
Yeah.
And it's funny because a lot of people don't remember my name. But I've met people in the grocery store and they've said things to me, and it's like, oh, I remember you. But the name's not there.
Sure.
And that's okay. They don't need to know my name as long as they know that I took care of them.
Yeah.
And let me know that I did it well. That's important.
Now, you made a comment about the pandemic, and it's still around. What impact did this have on the team, Tina? What have you seen happen to the workforce and the team? And you're clearly an individual with experience.
Yeah.
And tell me what you've seen from a team standpoint and from a culture standpoint, whether here, but just more broadly in nursing.
I've seen more people leave the profession because it does take a toll on your soul. It really does. You've got to be strong. You've got to be very strong. A lot of them are, even the new nurses, instead of coming in and being with the community, they're coming in, spending a couple weeks or whatever, and traveling. And, I understand the money, but I think it has more, it's not just the money, I don't think. I think they're still afraid, what's next around the corner.
Yeah.
If I can take this and travel and see other places and experience other things, I think a lot of them look at that also. Because there's places closer to their home that they could be working.
Yeah.
But they're not. They're going states away. I think the ones of us that have stayed, I think it has made, I think we're stronger for it. And I'm not saying that we don't get angry. We are still fighting our way back from everything that's happened. And like I spoke to you before, one of the ways that I'm dealing with it is I'm spending more time with my patients, not just giving them medicine.
Yeah.
I'm getting to know them more. And if it's just holding their hand, if it's holding them, if they're crying, if, like my mother, since the pandemic has started, she's really not done anything. She's stayed in her house. Goes to the grocery store, twice a month or whatever, gets what she needs, and then goes back to her house.
Yeah.
She doesn't go out. And she was a very active lady. She's still active, but not that way. And that's what we see with a lot of these patients coming in. They're like my mother, and I think about that. And it's like these people haven't had no interaction other than the phone because they're afraid even for their families to come in. So they're coming in to us, and they've been alone for so long. And not everybody has, you have patients that are difficult. Let's just say that.
Yeah.
They're difficult. But I'm thinking a lot of this difficulty is because they've been alone. And now they're with people, and it's like, I've got somebody to talk to. I've got somebody to listen to me. So the more difficult they are, the more time we spend with them.
Yeah.
And I think we need to make a switch to where they don't have to get to that point to think we'll listen, that we'll be there for them.
Now, when you and I last talked, Tina, you talked about how you made this decision, and it sounds, on one level, you're like, well, you chose to be a nurse. Of course, you're a compassionate individual, and yet you found yourself spending that little bit of extra time, because I remember you telling me that sometimes that's all they need is to be loved, I think was the term you shared with me.
Right.
What did that do for you when you started taking that extra time? What did that do for you as a caregiver? And you started to do this, I think, somewhere in the midst of the pandemic. Is that correct?
Yeah, but closer now, I think, because we've all been angry. All of us nurses are angry, and if they tell you otherwise, then that's not true.
Yeah.
We've all been angry. And I think everyone at some point had started not liking this profession. And it's not because we don't like the profession, but we didn't like what it had become. I think it was more during the COVID and that it was more toward the medicine. You did not spend time in the rooms with them. You did what you needed to do and you got out.
Yeah.
Even in the rooms that weren't on the COVID units. You got in the room, you got out. You wanted to limit your time with these patients, and that's not what nursing's about. Nursing has to be more than just medicine. And I think when I started shifting back, COVID's here, COVID's going to be here, there's nothing we can do about it. But for me, I had to get back toward the patient rather than the medicine. I still do the medicine.
You still got to give medicine.
But it's more toward the patient now. It's more toward the patient.
What did that start to do for you?
It made me love my job again, or my profession, not the job, the profession again. Because I was really getting to the point where I didn't like it. Didn't like it. Thought over and over about leaving. I didn't. That was rough, and I don't know if you knew that or not, but I had actually was going to go somewhere else. And I actually had a job somewhere else. But it wasn't about the money. And people look at you like, oh, well, you could have done this and this and this. And it's like, but that's not what it's about.
Yeah.
That's not what I think it's supposed to be about. And I stayed. I thought my team needed me more than... One thing about a nurse, they always put themselves last.
Yes.
Okay. But I thought my team needed me more than I needed to do that. So I stayed.
Well, I'm thankful you stayed.
I love Fort Hamilton.
Yeah.
Or Kettering Health Hamilton.
We're still the Fort family.
We are still a Fort family. Always will be.
Yeah.
At least while we're around.
Yeah. Now, talk with me about what advice you would give either your younger self or those new nurses who are coming on the floor for the first time. What advice would you give either yourself starting out or do you give to the folks that you precept and teach and help train, Tina? What would you share with them, or what do you share with them?
That they have to be strong and they've got to be courageous, because this is not a profession for the weak heart. It really isn't, because you will lose part of your heart every time you walk in the door.
Yeah.
For myself, I started out as an older nurse, went into it when I was in my 40s. So I had seen life, seen death, through the family, met multiple people throughout, from the lowest to the low to the highest around here. So I knew people. I think a lot of the new nurses aren't, I think it's almost like a shell shock when they come in, because they've gone from high school, they've gone to college, they've come to the hospital, and then they're in tears in the hallway. Because they're taught the medicine, in school.
Yeah.
They're taught some things, but you can't really teach humanity toward patients or empathy. And that's just something they have to learn, but they have to be strong enough to continue to do that, you know, until they get to that point. Because it's not, you walk in the door, oh, I've got that, because you don't. Because every day is different. Every day you're going to find something that breaks your heart. And if you don't find yourself crying in the hallway at least once, maybe you shouldn't be here.
Yeah.
I mean, that's terrible, but
Yeah.
you've got to give yourself to the profession. You really do. Because that's part of healing for the patients.
What gives you the most hope as you look to those new nurses? What gives you hope, or as you look to the future, you know, what do you think is better, or what do you see getting better?
I think as they come onto the floor and they're learning and they see the older nurses and they actually try to help them navigate through that, I think you've got some strong new nurses. I think because they were in COVID during school.
Yeah.
You know, and they couldn't.
Sim labs and virtual, and
they didn't have that hands-on.
It's not the same.
It's not. But I think talking to us and kind of seeing our viewpoint, and even when it comes back around again, I think they're strong enough to do it if they just give themselves a chance. We've got some good ones out there.
Tell me what you love most about working here at Kettering Health Hamilton, Tina.
I've always loved it.
You've been here for 14 years, so.
I've been here for 14 years, but when I was 13, I was a candy striper here.
Where did you work when you were a candy striper?
In the ER.
In the ER?
Yeah, in the ER. We had the little red and white stripes with the saddle Oxfords, and yeah. And I always told my father, if I ever become a nurse, this is where I would want to work. And it was actually the only place I applied to. So it's a good thing y'all hired me. Or I don't know where I'd be. No, I like Fort. I think, or Kettering Hamilton. I think we have a magnificent staff. I think the ones that have stayed, you've got a good core.
Yeah.
And we are like family. I think that's missing in a lot of other hospitals.
Sure.
But we are like family. We're not extremely huge. Everybody pretty much knows everybody, and we know everything going on in everyone's lives. We know the ones that are having difficult times, you know, and we try to help those, and we all seem to pitch in for that. And it is like a family.
Yeah.
It really is. I love Fort Hamilton.
Well, I know when I ask people what it's like to work with you, they love when you're working on shift. And when you're off, it's not quite the same.
They've told me that. It's like, what?
They also said that you're an individual that no matter the clinical question, you're always willing to help them out. And I want, you know, I say this a lot, and I really mean it. In healthcare, there is something truly unique about connecting with people. We've got our lumps and bumps, and you know, we've got our challenges, and yet there's something that is incredibly admirable about an individual such as yourself walking into the room and giving of themselves, not just handing out medicine or giving a food tray, but actually coming alongside and being the hands and feet of our Creator, and sometimes being an individual who can dispense or share compassion, which may be lacking in their lives. And so I know that we are better because of you, Tina, and because of the work that we do here. And I appreciate you sharing your experience throughout COVID. I know that as I talk with people, it's interesting. We don't talk about some of the things that have happened to us, and yet the story that you shared, there are a number of others who have been touched by what you've shared. And hopefully this is a way that helps let folks know that what they've experienced, that they're not alone, and that they can reach out to each other, because we're a family and we look out for each other. And some days we've got stuff going on, or we've got everything together and everything's perfect, and other days it's like the wheels are coming off and we need our family and our friends to help pick up and help round out our flat spots that we have as people. And I appreciate you sharing your story. I appreciate you showing up and the difference that you make in the lives of our community, whether they tell you in the grocery store or whether they just know that there was this nurse one night on 4 who cared for me. But I want you to know that you've made a difference in the lives of our community, and you continue to make a difference here at Kettering Health Hamilton. I just want to say thank you.
And thank you.
And I hope that we can continue to inspire, educate, and train the future caregivers. So thank you.
I hope so. Thank you.
Thanks for taking time to sit down today.
You're welcome.
I did tell her she could say no at any point.
Yes, he did.
So thank you again.
You're welcome.